Hello, I'm Dr. Alexa Bagnell. I work at the IWK Health Center and Dalhousie University as a child and adolescent psychiatrist. And this talk is for parents and caregivers around coping with change and uncertainty during the COVID-19 pandemic. I'm going to start with uncertainty and fear. Two tough words, and as parents, we definitely know what that's been like. In terms of the last number of months, there has been a lot of uncertainty, a lot of change, and all of us, I think, have felt fear at different times. Uncertainty is something that happens in our world, and with a virus and pandemic, it is definitely a time where change and uncertainty are huge in our life, and we don't know what the future brings, and that can be really tough. Uncertainty can paralyze us too, and can make us think, we're not going to be able to cope with this. Some of the ways we cope with uncertainty can be helpful, and some of the ways that we cope with uncertainty cannot be helpful. So what I'm hoping from this is that you as parents and caregivers learn some of these strategies for ourselves. I'm using them a lot, and sometimes I forget to use them and it's not so great. And also for our kids, so that you can be able to use them as a parent or caregiver with your children to help them cope through this time of change, but also to help them get ready for school and to cope with that back to school and being in school during this time where things are quite uncertain. I always bring it back to the brain because uncertainty, change, fear, they all happen within our brain and they really impact how we feel. The oldest part of our brain is called the limbic system. It's got our memories and our emotions. That is where our amygdala lives, and the amygdala is our fight-flight center. So it gets activated if we're in a really scary situation. It is really important because it helps us to protect ourselves and survive in a really scary situation. In situations like this, in a pandemic, we can have times where our amygdala fires up because we're pretty scared or we're pretty worried or something's happened and changed or we're worried about our kids, our family members. The amygdala is really important. It tells us there's something to be fearful of. The problem with the amygdala and that response is it sometimes can be paralyzing, so that we feel like we can't do anything, and it can keep us from moving forward and living our lives. And what we need to help our kids with and ourselves with is how do we feel safe enough and able to cope enough to manage that fear response and that uncertainty in our day-to-day lives as we go through the next number of months, which we know is, more of a marathon than a sprint, as we can tell right now with this pandemic. So how do we cope so that we have as normal lives as possible for ourselves and for our kids while still maintaining our safety and still feeling like we can cope and we can move forward? So I always start with the facts because there's a lot of misinformation out there. Google is not our friend in terms of what is accurate and what isn't. You can pretty much find out anything from Google that will support a claim, even if it's not accurate. So what are the facts we know about COVID-19? So we know that COVID-19 is a new type of virus from the family coronavirus. SARS-CoV-2 is the other name for it, and it spreads from person to person. We know spread is by close contact, usually within 6 feet with a person who's sick, and respiratory droplets are one of the main components of transmission, or by contact of the virus with your hands and then to your face. We know it usually causes mild symptoms, so mild flu-like symptoms, mild to moderate, that can be a cough, fever, and sore throat. We also know there can be other symptoms associated with it as well. Those are just some of the more common ones. However, in some situations, especially with older adults or people with underlying medical illnesses, the virus can have a much worse effect, and people can get very sick, and some people even die. And that is what we hear about on the news, and we know that has happened in our province, and that can be really scary and very difficult if you have loved ones in your household or that you're in contact with that are older or have these conditions. It is good to come back to our history in terms of pandemics so that we have some base of this isn't our first pandemic. And for many of us, it's our first one that we've really lived through, but in our world, in the last century, there have been 4 pandemics. The one that you will hear about the most is the Spanish flu pandemic from 1918 to 1920. This pandemic affected about a third of the world's population. So it was very, very widespread. It was very long lasting, and it had many deaths, 50 million. So that's the one you'll hear about the most, and that's probably where we learned the most in terms of distancing, so physical distancing as a real important public health measure in terms of reducing spread of virus during a pandemic. The SARS and the H1N1 influenza A pandemic, many of us will remember who are parents and caregivers because it happened during our lifetime, and both of them impacted differently. The H1N1 influenza affected 1.4 billion people, very, very widespread, had a very, very low mortality rate. So not very many people died from it, and there was a vaccine very quickly. And that is because it was influenza and there were already models of vaccines that could be adapted for that virus. The SARS virus was very, very deadly, we will say. It had a high morbidity rate, which is what we say when people who get it often die. Because of that, though, it did not spread as rapidly and not as many people were impacted by that illness, but it had a huge death toll for those who did get that illness. COVID-19 is different than these other viruses in that it spreads very, very rapidly, so similar to some, but it also affects, in this time, the older age group and those with more medical disabilities. We know right now that the numbers change every day for COVID-19, so this data is pretty much out of date already for this presentation because I put it on from August 10th, so a few days ago, and it will change every day from now on until the pandemic is over. The mortality rate really varies for this virus because every country is different in terms of both their healthcare and who's being impacted by the virus. So you will really see wide ranges in terms of the percentage of people that die from this virus. But we know that most people, over 80%, will have mild to moderate illness with this virus. Now I'm going to take you through a rapid change in what the landscape in Nova Scotia has looked like. I think that's good because we all have lived it in Nova Scotia, but it's sometimes good to see it laid out. Oh yeah, we have gone through a lot of change. There has been a lot that we've adapted to in the last 6 months. Boy, we're doing really well. That's what I want you to get from these next few slides. So this is the timeline of Nova Scotia events. This tells us sort of starting from March when the pandemic was declared, all the way through to July 31st when Nova Scotia made masks mandatory in indoor spaces. You can see the many different changes that we've had to adapt to during this timeline as new information became available. That can sometimes be really frustrating and hard to understand as to why do rules change, why are things changing? And it's because this virus is new. And we have researchers all around the world looking at the data, but it takes us a while to figure out, oh, this is the pattern, this is what's going on. And so as we get new evidence, as that evidence becomes really tested and tried and true, then new information comes forward with what we should be doing to keep ourselves and others safe. And that is why you've seen changes over time. You can see in Nova Scotia, we've also had some really serious events, tragedies, losses, that have also impacted our province during this time. And, you know, pandemics are hard enough and all the changes we've had to go through, but on top of that, to have had these losses within our province, to have had these experiences where people have really had stress and loss and grief has really added another layer that is really very difficult to quantify or explain as to what that's going to mean. We do know that people cope in different ways and that pandemics do increase our stress, so we know that it has been harder, but we also know that human beings are incredibly resilient and adaptable, and we rely on our supports, and in many ways our province has really rallied and supported those that have experienced these losses. There's been a lot, is what I would say, going on in the last number of months, and this barely captures it, I know, for many of us. And then there's individual experiences that all of us are going through. So that's our Nova Scotia timeline. I'm going to move into something that's a bit of a positive story in terms of Nova Scotia right now, which is this. So there are not many curves like this in the world right now. This is our Nova Scotia number of cases. And from the very beginning, you heard Premier McNeil and Dr. Robert Strang talk about how we needed to flatten the curve. This is what a flattened curve looks like. There are very few places that have curves as flat as this, I will say. So we are very fortunate. We live in a very, very good place in terms of the virus, and everyone in our province has contributed to this success. Our kids have, you have, our educators, people who've sacrificed by coming home, working from home, doing things in a different way to reduce spread of this virus has led to this curve, which is flat and means that we are in a very good place in terms of moving back to school. So just from a very positive perspective, living in our province. And this is just looking at the number of cases in terms of age range, so the percentage in age range. And you can see that most of the people impacted by the virus are in older age group ranges, and only 10% of them are in children and adolescents, so under 19. And just reminding you of the most updated public health measures. And this is something that we remind our children about as well, and will be a very important part of the going back to school, the hand washing being the number one thing. We've talked about that from the beginning. It's been really emphasized. I think that people are really doing well with that, but hand washing is the number one thing for preventing spread of this virus. The next thing is also the physical distancing. So those two things are the core components. So being 6 feet away from someone and also hand washing and avoiding touching your eyes and mouth. If you've touched another surface, you need to wash your hands. Then staying home if you're sick. For a lot of us, that's something really different. We used to sort of celebrate people, oh, you know, they never miss a day, they'll even come in sick. And that's a really different world now. We don't go places when we're sick. We stay home when we're sick. And that's really important for ourselves, and we actually should have been practicing that probably a long time ago, but it's also important to protect others. And that will be the same for our kids. And so that staying home when you're sick and staying away from people who are sick are very important. And then the last part with the non-medical mask, that is relatively new. And for many of us, getting used to that and practicing that is really important. And also for our kids, getting used to that. Now we have to wear it in all indoor public places, and there will be parts of the going back to school where masks will be a key component. And getting our kids used to that, wearing them ourselves is going to be the earlier we practice and the more we practice, the easier it gets. So talking about that, knowing that that is going to be part of our new world and reality while the pandemic is going on is something that as adults we need to get used to, but also for our children as well. So I'm going to talk about some strategies that you can use in terms of coping with uncertainty and change. And I use these, I say, for myself. They're for all age groups, but they're things you can teach your kids too. But the very first one that I want to emphasize is something that if you join the first webinar on wellness, it's really thinking about your own self-care. So we say you cannot pour from an empty cup. And that is because if you are not taking care of yourself as a caregiver, you will not have much left to give to those that need you, such as your children. So really thinking about that and prioritizing that. For some people, they think of that, well, taking time for myself is selfish and this isn't the right thing to do. That is, you need to reframe that and think, if I don't take care of myself, then I won't have much to give to my kids and I won't be coping that well, and they'll get that message when they leave the house in the day. They'll know that I'm not coping well. So really modeling for your kids too, that self-care is really, really important. So ways to think about self-care, and there's many components to it, but think about the basics of sort of managing stress and taking care of your health. So are you getting enough sleep? And if you're not, how are you going to change that? Are you eating well? So eating enough meals in the day. Are you making sure that you are eating a fairly decent blend of nutrition? Doesn't have to be perfect, but are you eating enough of different areas and food groups? Are you exercising? And that doesn't have to mean doing a sport, but are you getting out of the house? Are you walking around? Are you doing something that actually gets your heart rate up and gets you physically active? And the importance of that is really, it's very brain-based. So sleep, incredibly brain-based. That is what resets us in the day, and you can always tell yourself if you haven't had enough sleep because things irritate you more. The more sleep deprived you become, the smaller the things are that bother you, and the more overwhelmed you become from fairly small things. So that's a good indicator. The stress level that you feel throughout your day can really be decreased by exercise. And so I say, even if you're not someone who exercises or your kids aren't, doing things small like walking a certain distance or giving them tasks that involve being active, even if it's not joining a sport team or doing something that actually gets them out and moving is really key to actually managing the stress level and helping them cope. And so keeping your cup full is the number one thing, and I will say that again near the end, but self-care. The next is to be mindful. When I say be mindful, I mean, recognize that our thoughts at times are going to get overwhelming. We have all had experiences, whether we've been on social media, or I call it when I keep clicking different links. So, oh, that looks interesting, I'll read that. And then you're in another article, and then you're reading another article. And then you realize that actually you're feeling pretty overwhelmed by either the negative content or the overwhelming content of what you're reading. And so really being aware of that and knowing, okay, sometimes my thoughts are going to get out of control. I'm going to feel overwhelmed by them. What can I do about it? Because otherwise my mood, my ability to cope, my feeling kind of paralyzed instead of being able to move forward with what I need to do will be impacted. So the STOP method is a really easy mindfulness technique that really starts with recognizing that your thoughts are kind of getting out of control. You're feeling overwhelmed by your emotions, and you stop. You take a breath. And then you observe. And you observe your thoughts. So what am I thinking about right now? And this is something you can teach your kids too. What are you thinking about? And really observing the thoughts just as thoughts, not with a lot of emotional content if you can, like not thinking about all the negative stuff with it, but just like, that's a thought, and just letting them happen. And then proceeding. So letting those thoughts kind of, I sometimes say float away, but be there, but not dwelling on them, and then move to the next thing that you need to do, which is proceed. There are other mindfulness techniques that you can use that can be very helpful. One that kids do really well with is called the 5 senses. I tend to use 3 senses with kids because I find that all 5 are not that easy for them to do. So the first sense is seeing. So you say in your head, 5 things I see. And a time that this can be really helpful is, say you're really upset by something, angry, scared, fearful, or just feeling overwhelmed and upset for, might not even know the reason. This can really help calm your brain down. You remember I talked about the limbic system at the very beginning in your brain. Well, the limbic system has all our sensory information feed into it. And by actually paying attention to the things that we see, hear, and feel in a really calm way, it actually calms down our amygdala and our brain so that we can think clearly and make a plan and start to feel a bit better. So 5 things I see. Usually you teach kids to do this in their head, but I'm going to say it out loud just so you can get an idea. So I see a star, an exit sign, a camera, a chair, and a light. Then you do 5 things I hear. I'm not going to say those out loud. And then 5 things I feel. And they could be things like how your clothes feel, the temperature of your body, how your feet feel on the floor, if you're sitting, if you're standing, how your hair feels on your head. And those are things that you want to try and use to calm your brain down, and it actually calms your body down as well. So those are some easy strategies. Many people also use different exercises such as yoga, that can be really quite helpful with both deep breathing as well as mindfulness. So you're really focusing and calming your brain down. The other important thing for dealing with change and uncertainty and being able to cope with it is having a routine and good communication. So there are some things we don't know and we can't really predict at this point, but there are some things we do know and we can prepare for. And so starting to talk about that at home with what are you getting ready for with school? What are the first couple weeks of school going to be like? How do you communicate in your house and check in about how people are doing? And how do you set up a good routine? So we know that we've been out of our routine for a number of months, especially our kids. And how do you start to set that back up? Sleep routines, so they're sleeping more at night and not through the day. Eating well again, getting up at a reasonable time in the morning, even practicing getting dressed again for school, because sometimes kids have been more inside than they had been in the past. So really thinking about, okay, what do we need to practice that we're not doing so well with right now that we need for the getting back to school readiness? Thinking about the excitement of school, and so bringing that positive in as well about what are the things they're looking forward to and what are the things they need to do to get ready for school. Visual things can really help at home. The thing like the dates and what to expect, and then what the routine's going to look like in the morning. And you'll get communication from schools too, as you've had some already, from what we're going to expect in moving into schools, and letting your kids know about those too. So this is what you'll expect when you walk into the school. This is what you'll expect when you go on the school bus. This is what a classroom could look like now, and what they'll need to do to keep others safe and themselves safe. Practicing the mask wearing is a key component, and we talked about that, and thinking about how you're going to build up to that too. So for some kids that will be a really new thing and really hard, and so you might want to start early and be doing a little bit more time each day, also getting them into picking their mask and figuring out what they like and what they feel comfortable wearing, so that they start to feel that they're a part of it, and also it's part of their responsibility in keeping themselves and others safe. These are some basic emojis. As I say, I'm not the greatest with emojis, but these ones are pretty self-explanatory in terms of emotions. And the importance of this slide is that one of our strategies is to really allow and check in around emotions. Sometimes we think, okay, we shouldn't talk about it because we're just going to make them more upset, or if they're scared, we don't want to talk about them being scared. But I always say, be curious. So ask them how they're feeling. Don't say, oh, you must be scared, or you must be upset, because they might not be, or they might be at a different time, but opening it up that they can talk about how they're feeling about going back to school. You may hear mostly that they're excited, whereas you as a parent might feel scared. Or it could be the other way around. You might feel really excited, and your kids might feel really scared. And knowing how they're feeling and not deciding for them can be really good with moving forward with, okay, well, how you feel is normal, and everyone feels things at different times. And during a pandemic, we would expect people to have pretty strong emotions at times. What are we going to do about it is the next question as a parent. So you validate that emotion. You say, yep, that makes sense. I can see why you'd feel that way. Let's talk about that. And then what are we going to do about it so we can move forward and you can feel better about going to school, or you can feel better about having to wear a mask. Those would be examples. So really thinking about that, talking about it, but giving room for those emotions, for people to talk about those emotions and share them with you is a really key part of feeling like you can cope with that uncertainty and change. Focusing on the positive is another thing, and we will talk about that with sort of positive thoughts, but focusing on the positives of what's going on in our province can help kids who are feeling uncertain or scared in terms of what are the real things we know that are positively going on around this virus or around the current pandemic. So we know we have really strong leadership in our province. We know we have excellent healthcare professionals. We know we have really smart researchers who are working on vaccines. We also know that there have been past pandemics in the world and people have gotten through them, and actually there's been some positive things that have happened from that, and really looking into that. So what are some of the good things that we've learned already with this, and we will hopefully take forward into the future. And what are the things, some of the positive things that have come from other pandemics? And then the last part is really looking for positive stories. So the news is often filled with more negative stories on the front, but it doesn't take that much digging to get to positive stories and really coming up with positive stories, people who are contributing and doing things and ways to give thanks. And it's not just about being grateful, it's that actually in itself is a chemical reaction in your brain. So when we look for positive stories, when we hear positive stories, when we give thanks to others or do things for other people, we actually release really positive chemical messages in our brain that are really good to improve our mood, but also decrease our stress. So it has a chemical reaction there that can also be helpful for our kids. So I'm going to talk about three main strategies. I'm going to talk about positive thinking, I'm going to talk about problem solving, and I'm going to talk about realistic thinking. So starting with positive thinking, this is a basic skill that actually is quite tricky at times for kids and for adults. We tend to sometimes go right to the negative of our day. So you hear about a day as like, it was terrible. And then they can list a whole bunch of things that were terrible. And we can do that as adults too. We sometimes tend to lump everything together, and then we actually make our brain not able to remember anything good that happened. So we say, to help with that, think about two positive things first. You have to identify two positive things that happen in your day. And this is a good thing for us to practice as parents and caregivers. What are two positive things that happened in my day? And I always say, it cannot be, it was not as bad as yesterday. That is not a positive thing. It has to be something specific that happened that day that was positive, that you either noticed happen, or you did, or it happened to you, but really identifying that. That completely changes how your brain activates and how positive you feel. And it decreases how everything else seemed negative. It doesn't mean that negative things didn't happen, but it doesn't color the whole day into a negativity scheme. So I would say seeking out, we talked about seeking out a positive, so looking for the positive, and then you can go to, these are a couple things that didn't go so well. As parents, we're often super hard on ourselves, and we talk about the things that we didn't do well. We are under a lot of stress. We're working or not working. We've had a lot of stress with the pandemic. We may have a lot of changes in our job or at home. We've looked after kids at home for more months than we usually would be. So there's been a lot of stress on parents, and that can make it really hard to think about the positives. So you really have to start to train your brain and also be very kind to yourself. So the positives do not have to be huge. They can be small positives, and that's the same for your kids as well. And making sure that those small positives are still very important positives. And then setting positive goals. This can be very small goals, and they should be attainable and things that you care about. But setting those small goals can make you feel a lot better. Setting big goals or many goals can make you feel really like you haven't accomplished things. You're feeling so overwhelmed, and now you weren't even able to do all this. That is not what you want to set yourself up for. You want to set yourself up to feel successful, and you also want to do that for your kids. What are some small goals that we could set up for this week that we can check off by the end of the week? And then keeping track of those can make you feel like, wow, look at what we did. And so thinking about that as we're moving forward into the fall. These are the things that can stop us in terms of our problem solving and moving forward. So sometimes we can get super overwhelmed by the things that we cannot control. And that's when our thoughts kind of spiral into the negativity. So we need to focus on the things that we can control. And for kids, that is a big thing. So a lot of time, the worries that kids have are about the things they can't control. And if we can help them think about, okay, yeah, those things are tough, but what are the things that you're worried about that you can do something about? Write them down and then figure out, okay, so what are we going to do about these things that you can control? What are the things that you're already doing that you have control over that make a difference? And the problem solving and realistic thinking are two skills that all age groups can learn. Problem solving is really important because a lot of times when we're fearful or scared or feeling overwhelmed, we come up with what I call avoidance solutions. So we come up with the, I can't do it, I'm never going to be able to do it, or I'm really terrible at that, those kind of things. And so the problem solving is really to come up with more positive solutions. So how do I figure out this problem? What is the problem I'm trying to solve? And then come up with a whole bunch of solutions and then try them out. And so for students, or for your kids, you might be thinking, okay, so they're really, really worried about getting sick, let's say, and going back to school. Maybe that's their worry. And so you say, okay, well, what are the things that are in your control that you can do something about? And let's make a list of those things. So, proper hand washing. I'm going to be wearing my mask. I'm going to be following the rules. So all those things that are really important that they're already probably doing, but you're emphasizing just to give them, these are things you're already doing. You do have some control over this. And that can really help them in that problem solving and not feeling like they're kind of stuck or that they can't move forward. In realistic thinking, we will use for younger kids sometimes thinking like a detective. So this is your worried thought. You're really worried about you're not going to be able to do well in school this year, let's say, because it's different. You won't have, you won't be able to have the same amount of time with your teacher, or you won't be able to learn the same because you missed a couple months of school last year, and you maybe didn't understand things as well as you would have if you'd been in the classroom. So this might be a student talking. And then come up with, they might have a worry that they're going to fail as an extreme. We call it catastrophizing. So coming up with a more realistic way to think about, well, yeah, I mean, you probably did miss some stuff in the spring, but let's think about it. Who else missed stuff? Like everyone's lives changed then. And so do you think that your teacher's going to start right back at the beginning for everyone, or do you think that they're going to skip those 4 months and think that you learned it some other way? And so trying to get them to be realistic about it, like everyone's in the same boat, we all missed that time, and now this is how we're going to move forward. What are the things that you might need help with? And coming up with some realistic ideas about how they could ask for that help. But being a detective, thinking realistically, and not catastrophizing, and helping your kids with that. And then the last big one is staying connected. We know we are social beings as humans. That is a very important part of our makeup. It is probably one of the things that was most difficult at the beginning of the pandemic, when there was a more stay-at-home time where people were mostly in their own homes and not able to be in contact as they usually would with friends and family. That was really difficult. And we know that as our brains cope with things, that contact with others that we care about, our families, our friends, spending time doing things that are important in our lives and having fun are really key to coping with stress, to feeling like we can make it through change and cope with that uncertainty. Music, physical activity, nature, everyone has their sort of things that make them feel better, and it is very key to make sure our kids know what those things are and are really encouraged to use those things to help them to get through this change time. And don't forget humor. So humor is a brain-based treatment, I will say. Releases endorphins that are very important for managing our stress and helping us to cope and feel better. And it also gives us a bit of a break at times. So I think all of us can remember times when laughter is a really great medicine, really helped us. And so using humor, this particular meme is one that I think did the rounds in many, many times, but on physical distancing. And you could even use this as a math problem with your kids and say, what do you see as a problem here from a 6 feet distance perspective? Because the sideways part didn't quite make the 6 feet. So I'm going to review the things we talked about in terms of how you can help. All of these strategies you should be using on yourself as well. And I have to say that there have been times when I have not done as good a job myself and reminding myself of using them. And the way that I know that is if I become more overwhelmed, negative, feeling like, oh, and this is going to happen to all of us at different times. And I try very hard to be very forgiving of myself and then move forward. and think about these strategies. So the very first one is to be open. So open to talk to your kids, to talk to each other about how you're feeling, share that, and then normalize it, because all of us are going through it. And then what are we going to do about it? And making sure that there is some action from it, but really acknowledging that feeling like this and any emotion you're feeling is okay. And that at times it's okay to not be okay, and that you're there to support them, and also that we're all going to get through this. Validating those emotions, like I said, really important, and making sure that you share your own emotions too in an age-appropriate way. So if you're also feeling things, that's okay to share that with them. And then how did you cope with it is a great way to teach your kids, oh yeah, everyone's having this kind of experience. And people can get through this, and I've actually gotten through a lot already. So I have a lot of skills that I didn't even know I had. Correcting misinformation, and that's important because you will hear a lot of misinformation, and that actually can make the stress level worse. It can make uncertainty more because you hear one thing from one source and one thing from another source. So really making sure that the information that your kids have is accurate about the virus and about what they're supposed to be doing to keep themselves and others safe. Monitoring, which is really checking in. So having regular check-ins with your kid. As parents and caregivers, we definitely know our kids the best, and being available to them to check in, having family time that's kind of set, if it can be a family meal or some activity that you do on a regular basis where you can check in and see how are they doing, and leaving that as an open space to be able to see, you know, how was your day? What are some things that you've been thinking about, and really having that conversation. Prioritizing, and that's really the being kind to yourself, thinking about what is in your control and what isn't in your control, and also being reasonable about expectations. So prioritizing is knowing that at times we're going to be maxed, and that will be the same for us as parents and caregivers, and also for our kids. And there are times that we will not be able to do everything. We will not be able to get it all done. We might have very high goals, and we were going to have to modify them. And for our kids to let them know that that's okay, and that they can prioritize, and really emphasizing for our kids effort and not always outcome. So really that they're trying, that they're doing the things that they can, but not having an outcome as the main thing that indicates if they've been successful. And that will really help them feel more competent and capable, and also be able to cope better if they feel like, as long as I do my best, as long as I'm putting effort forward in this, and I don't have to do everything at once. And then emphasizing the things that they're doing already well, emphasizing the things that they have control over, and making sure that they continue to do those things, and really notice when they're using good coping skills, when they did well with something that was stressful, can really help reinforce that for them and make them continue to do that. And also think, hey, yeah, I did that. That was a really good job. And as parents, we are our kids' biggest role model. That does not mean we have to be perfect. So they watch us all the time, they listen to us a little bit, and they really notice what we're doing. So the more that we can do from a calm, curious, supportive way, the better that they're going to do, but it does not mean we have to be perfect. And if we have an imperfect moment or day or week, we can just own that and say, yeah, that was a tough week. There was this going on. You don't have to get into great detail, but then I realized it. I'm not sleeping enough, or I'm not doing enough of this, and I realized we need to do some more things together that are fun. So I, really role modeling for them how you coped with it, because they learn a lot more from what we do than what we say. And the more they see us coping and doing well with this, but also acknowledging that at times it can be tough, the better they're going to feel about, okay, I can also do this. And if you're worried about your kid, you need to know that you should not worry alone. We talk about that a lot in my work of not worrying alone, and that is true for parents and caregivers. It's true in schools. If you have someone that you're worried about, besides checking in with them regularly, so if you're checking in with your kid, but reach out for help. So that could be reaching out to a friend who may have had a similar experience and could support you. It could be reaching out to the school and reaching out to a school support who knows your child and can actually help and say, yeah, these are things we're seeing as well. Reaching out to your family doctor, and there are mental health supports as well, but do not worry alone. And teach your kid and yourself to make sure that they know it's okay to ask for help. That asking for help is not a sign of weakness, it is a sign of actually coping and being able to manage this. So being there and also being open to that, asking for help. One support that is free and available and is an app for phones is the MindShift app from the Anxiety Canada website. It's good for all ages. Younger kids, probably not so much. There's nothing in the content that's worrisome, but it might not be as understandable. But late elementary all the way through to, I will say, full lifespan has tools on this app that they can use. It has relaxation tools. It has talking through imagery and calming techniques. It has help with realistic thinking and detective thinking. It has really great resources so kids can use it and adults can use it as well. And that resource is on the Anxiety Canada website and it's free. Then we also have some other resources listed there. There's the childmind.org has a back to school resource, which has some great information about preparing your kids for back to school. The Kids Help Phone website has some really good resources around COVID-19 and also helping kids cope with fear and uncertainty. And then the eMental Health website from Ontario has some good information on coping with COVID information. And then if you're really concerned about your child and you think they need mental health supports, there is a 1-number provincial line now that you can call for an intake. And this line will actually connect you to whatever is the most appropriate resource for your child where you live. So there's only 1 number now needed in the province, which is much simpler for families. And please know that that is there for you if you need it with your children. And I really appreciate your attention, and I wish all of you the very best in this transition back into school for this fall.